orientation of a patient. If, for example, so this is my patient. So what will be my nursing documentation? So first of all, I have to check what is the orientation of a patient. For example, I have to perform the chest physiotherapy for the secretion or for the omit of the sputum collection in order to provide a proper breathing pattern. So I have to communicate with the patient, I have to make him comfortable. After that, I have to see that what type of breathing difficulty, does he need the normal physical chest physiotherapy, or he is having that excessive breathing difficulty. I have to measure the saturation, I have to check the saturation. On that basis of the condition, I have to see that what type of physiotherapy at what emergency level I can provide to the patient. So after that, what I have to tell, I have to arrange my articles. So in the articles, I will tell you about the chest physiotherapy articles. Every article is not present here, but after that I have completed the tray set. Still two things are not present here because those two things are used in case of 20 patients. If the patient is on ventilator, if the patient is GSC Glasgow Coma scale is below the semi-unconscious level, so those two instruments, ventilation और जिसे ventilation कहते हैं जो आपने hospital में देखा होगा, so that thing we cannot keep that in our lab. So virtually you will imagine. So if the patient is on a tracheostomy, at the time we are using with the help of a suction apparatus. Suction apparatus is available here. I will tell you, I will explain you with the help of suction apparatus how we are excreting or how we are taking out the sputum collection with the help of suction. So in tray setting, first of all, what you have to do generally when you have to perform the procedure, after the bed setting, after seeing the patient is comfortable, after checking everything, you have to manage up your articles. In articles, what are the basic articles which we are using in chest physiotherapy? There should be a small size or large size of a tray.
Can you explain like a clean tray or a sterile tray? Which one you are going to explain? The procedure is a clean procedure or a sterile procedure?
I will tell them about the both. Right now, it's a clean procedure.
So you should tell that a clean tray containing total articles.
I will be telling you about basically chest physiotherapy is done in both ways, clean as well as sterile. So right now I will tell you about the clean tray. So this is a clean tray consisting of various types of articles. After that I do have a two number of kidney tray, that's a small size. Along the kidney tray there is a sputum mark in order to whenever there will be a collection of a sputum, so we have to collect in the sputum mark. Apart from the
should contain sputum cup should contain
this
why Subra? Why is disinfectant should be there in the sputum cup? What Sidra or so the sputum should not stick at the bottom of the sputum cup. So always disinfectant should be placed in the sputum cup. Okay, fine then.
After that, I have kept the stethoscope should be there because with the help of a stethoscope, we have to auscultate, try to check out the different types of sound, what type of a wheezing sound is there. While we will tell the patient where to cough, we will see that how much the inflammation of lungs will be there. Apart from the stethoscope, there is a clean slit sheet because whenever we are performing the chest physiotherapy, we can't directly perform on a sweater, on a cotton-like shirt. Generally, we are exposing that particular part, apical region or clavicular, whenever we are performing the procedure, we are exposing that part. So at that particular time, we have to put on the slit sheet and we have to cover up that area. After this, we also have to keep in the set one surgical glove because gloves are the most important part. PPE. We generally use PPEs in the hospital, but in tray, gloves should be there. Apart from the gloves, with you should usually carry out your mask. From the gloves, after the most important part is pulse oximetry. You might have seen that. With the help of pulse oximetry, we are performing the.
What is the use of pulse oximetry?
Oxygen saturation, correct. Because we are giving the chest physiotherapy.
Minas, what is pulse oximetry? Come here. Come in the front. I want you to be in the front.
This is the pulse oximetry because the most important function during the chest physiotherapy, we have to maintain the saturation level. If there is an excess of sputum collection,